Mr. Scott. Mr. Burlison, you're recognized for 5 minutes.
Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
You know, I agree with the remarks that pharmaceutical costs are going up and that they are a driving force, and agree that 22% of every dollar is now in healthcare going to pharmaceuticals. But unfortunately, the goal of this language, if it's to reduce or lower healthcare or prescription drug costs, I think the bill gravely misses the mark here. And again, I'll reiterate, having known firsthand, sitting on a board that covers the lives of over 100,000 employees and retirees, it gives you the ability to negotiate with insurance carriers and PBMs. And sometimes if a PBM is costing too much or they're not providing good care, adequate care, or transparent care or information to the employer or to the employees, then you get to pick. Thank God we have a free market. In fact, a Bank of America study showed recently that 36% of employers have done just that. If they, by using costs, they've picked a different PBM. But what we're doing here today is essentially, we're complaining about the price of steaks at a restaurant, and in order to fix it, we're going to go after the food broker and impose regulations on the food broker. This will not help reduce the costs of healthcare. I'd like to enter into the record, Madam Chair, a report from the OIG that was released earlier this year.
Without objection.
Thank you. What this report says is that between the years of 2015 and 2020, the Department of Labor Office Workers' Compensation Program wasted over $321 million in taxpayer money. And how did they do that? Because they failed to use a PBM to control or contain the costs of their pharmaceuticals. Even worse, the report said that they did not effectively monitor their own pharmaceutical policy changes, resulting in inappropriate prescriptions and potentially lethal drugs, including 1,300 prescriptions for fast-acting fentanyl. While we hear about that transparency is the answer, there's nothing more transparent than the employer or the buyer knowing the full costs of the plan. And so, again, I will be opposing this amendment. I think that the more that we do to eliminate the ability of the negotiating arm within healthcare on pharmaceuticals, it will only benefit big pharma. It will only benefit pharmaceutical companies who wish to make even more profits than they do today. And I yield back.